So the first thing we do, because the microneedling sometimes can be a little uncomfortable, is we put some numbing cream all over the face to help patients kind of tolerate it a little bit better. Not that it's painful or anything, but it's just eases their anxiety as well, knowing that it probably won't be too bad. And so this has been left on for probably about half an hour already. And then what we do is we just go ahead and wipe this off. This also wipes off some makeup or any kind of debris that needs to be taken off, because we don't want to needle that into the skin. So it's like a lot of times with sun damage and kind of just the environment and everything like that, our collagen fibers usually don't align very parallel and straight. And that's why our texturing on our skin kind of isn't normal. So a lot of times with, like I said, with the environment and everything like this, the collagen kind of they don't heal exactly right, they heal like this. So what the microneedling does is it goes in and kind of breaks that apart. So collagen is usually like a rope. You can imagine collagen as a rope that's roped upon each other, and there's multiple ropes and they cause bigger ropes and stuff like that. So it's usually the perfect skin would be like collagen fibers that are aligned parallel and straight to each other. With the environment, with sun damage, with acne scarring, with things like that, sometimes the collagen, because everything gets broken down and built up. Exactly. So the collagen, instead of going straight, is kind of like, weird like this, and that's what causes weird texturing and bumps and lumps in our skin. So what the needling does, it goes in and kind of goes, kind of breaks it apart, and then allows it to kind of align a little bit better. So stem cells are good in the fact that it kind of helps stimulate your own kind of collagen and cells to grow, and it's kind of like putting fertilizer on a plant. So the plant's going to grow anyways, and by doing this micropen, it's going to help stimulate the collagen and grow, but you're adding fertilizer to it, so it's going to make it just that much better. So the first thing we do, we're going to start in the forehead here, and rub some of these stem cells on here. Pretty much just let it glide on the skin.
Wow.
How do you feel? Probably don't feel too much, right?
No, it's great. And you do this in sections?
Because the stem cell tends to dry up after a while, so I do it in sections. Some more stem cells on there.
It sounds like a big bumblebee.
Yeah. And then I crisscross it to make sure we hit everything. So I went this way, and now I'm going to go this way.
And this is something people can do just how often?
You can do this probably every 2 to 4 weeks, depending on how bad your skin is and how quickly you recover. So the recovery for this is fairly quick. Within about 2 or 3 days, you're pretty much back to normal. And so you can see the areas that we've done, you're a little bit red already. So that's good. Feeling all right?
Yeah. Okay. Yeah, it almost feels like a little sunburn.
So your skin can possibly be a little bit dry after this, so it's important to use moisturizer.
Say if one of the actors, if people want to do, can they just apply makeup afterwards? Is there something that you do?
I would probably wait until the day after to do that, or even the day after that, depending on how deep the person, whoever's doing it, does. And then sometimes you'll see tiny little bit of what they call punctate bleeding. There's tiny little bit of blood that comes out, And so once all that's healed and closed over, then yeah, you can do makeup, which is usually about 1 to 2 days.
Okay.
So the day of, I wouldn't recommend doing
Right.
anything.
Yeah, this is their
It's
process
open.
a little open with
Exactly. You don't want to be blocking them.
right. Or getting it infected or who knows what.
Exactly.
Mhm.
Exactly.
Is this okay with any type of skin?
Yes. So the good thing about microneedling is that it's safe for all types of skin. There comes to a point where there's something CO2 lasers that I'm sure you've heard of, or fractionated lasers such as Pixel or those kinds of lasers. They they also get rid of scars and texturing of the skin, but with lasers you have to be careful with darker skinned individuals.
Right.
So anybody my skin color or darker, it's recommended to not do lasers, only because there is a risk of damaging those pigmented cells, and if you do that, you can cause skin color changes. However, with the pen here, the micro needling, it's safe for all skin colors. So um, there's no damage to the melanin, which is or the melanocytes, which are the cells that produce the
Right.
pigment.
Hyperpigmentation
Mhm.
or not. Because I have a lot of dark skin clients,
Mhm.
brown skin, and they always ask me, well, that's because they, even with the bite of a mosquito or whatever, they create this almost keloid looking
Mhm.
with a lot of pigment here.
So I'm gonna go around your eyes first in here because the skin there is pretty thin, and then when we do your face, we'll go fairly deep there. Okay.
Okay.
Just letting you know where I'm going. Again, rubbing the stem cells all over.
Oh, wow, yeah, I feel the difference.
There's a little difference.
Oh, yeah. It's almost only like the tips are touching.
Mm-hmm. So we're just gliding this
Right.
across the areas.
I know that it's a huge difference in between these machines. I know about this machine and it's top of the line in the industry because if you go to eBay or Amazon, you can buy from China all kinds of these machines that I don't think is the same.
Mm-hmm.
Same metal. Can you tell us a little bit about that so people don't go ahead? Oh yeah, I'm gonna do that with the machine that I just bought in eBay.
So everybody, I wouldn't use just something from eBay. This is from a particular manufacturer who is well known for their quality and standards, stuff like that. Anything you don't want to get, you don't want to get cheap quality because you get what you pay for,
Right.
which is the bottom line. So
Right.
it's important to make sure that you get equipment from a renowned manufacturer. These manufacturers usually have reps, which are like where they come in and kind of teach you about their pen specifically. If there's not a rep, then it's probably not very good if they don't have a representative to come and talk to you about it. So that's one way to weed out what's a good, strong company versus.
Yeah, I had a girl that wanted me to partner up with her with a needle.
Uh-huh.
Her, you will disinfect. I think
Oh,
that's a
yeah.
little risky.
Yeah, I think that's a little risky. These are all disposable needles, so this plastic tip comes
Right.
off, and that way everybody gets brand new needles. It's more costly, but it's again, like I was saying before, patient safety is the most important thing.
Cross contamination, right?
Exactly.
Some people can have who knows what.
Who knows- exactly.
Blood cells. Yeah.
Mm-hmm.
Mhm. Yeah, 'cause that's what she did, and she was like, "Oh no, you just soak it in alcohol," but
I wouldn't do that.
I wouldn't do that. Yeah, I think it's a big difference, and they sell them all over the internet, but they're not professional. We don't know the metal, and if the needles are not fully straight on, it can cause really big tears.
Mm-hmm.
So they even sell the numbing creams, and I'm like thinking,
Yeah, the numbing cream.
cream. Yeah,
It's probably not as strong as the numbing cream we can get
well, not what
as a
is it?
physician.
Yeah. Again, like we were saying before about the surgery,
Mm-hmm.
You can probably find anything to look for it, but it's best
Exactly.
to stick to professional
Exactly.
implements and yeah.
If you look hard enough, you will find whatever you want for the price that you want. So
Mm-hmm.
that doesn't mean it's always good.
Right, but the integrity of the product or the person selling it is sound.
Mm-hmm. So we're going to go
How
really
did you
deep on you.
compare? Because I remember before with this doctor that we had this line of skincare.
Mm-hmm.
People were really, really, really into the rollers, but I know for a fact that those rollers can tear up where this needle is going up and down, no?
Mm-hmm. Yeah, so this needle is oscillating, so it goes up and down. Like you said, with the rollers, it's more of a physical. You're actually putting the needles in and out. So if you don't do it straight or perpendicular or anything like that, you can cause little tears and issues onto the skin. Whereas this one, it oscillates up and down, so you don't have to worry about making the needle go in or out of the skin. With the roller, it's more of a physical thing, like how hard do I press, how soft do I move. So it's a lot of technical issues that can go with this. Where this is, as long as you glide over the skin, the machine is actually doing a lot of the work. It's kind of like a toothbrush between a regular toothbrush and an electric toothbrush. The electric toothbrush, you just let the machine do its work and you kind of just glide over the skin, whereas like a regular toothbrush, you put pressure and stuff like that on there.
But you can do a lot of damage with either one.
You can.
Mm-hmm. Right.
So you have to learn how to use it both ways.
For me, I prefer the trained professional.
Mm-hmm.
And you can do this after you do fillers, so it will be a preference to do fillers and let it heal.
Mm-hmm. I would probably do, either way is fine, because we're not pressing very hard on the skin. The fillers really won't move. You're treating two different things. So with this microneedling, you're treating the actual skin itself. It's not going deeper than the skin. It's just going to the mid-level, maybe a deeper part of the skin. Whereas the fillers is usually the deeper part of the skin or under the skin that it's treating. And so you're treating two different areas of two different sections. And so they don't really overlap or coincide or anything like that. One won't affect the other. It's safe to do both of them if you want it to at the same time. In fact, we do often do that sometimes. If somebody wants filler here, sometimes we do it at the same time.
Oh, fantastic.
So yeah, it's definitely.
So they don't fight each other.
Mm-hmm. Yeah, they don't fight each other. Exactly.
Do they do the microneedling in the lips, or is no need for that?
There's no need for that.
Right.
We do like the upper lip, not the red part of the lips, but yes, the upper lip and the lower lip around where the vermilion is, which is the red part. The skin area, yes, we do microneedle that. That can help with some of the lines around the lips that a lot of people do complain about. So.
They need to start making the gestures.
Mm-hmm.
Either smoking, quacking, or always judging.
That'll do it.
Because we're going to continue to do.
Mm-hmm. Exactly right. So how do you feel now?
It's good. It's just like a little sunburn. That's what it feels like.
And that's exactly what it looks like right on the screen here. It just looks like a little sunburn, a little bit red.
I remember doing that over and over. I don't know how I have skin. Really bad, girl.
Oh, you did?
Oh, bad. I would just be in the sun days at a time.
The sun isn't very good for the skin.
Yeah, I know.
The good thing is you have pigment in your skin, so you're more protected than somebody who's more lighter.
Oh, I see, yeah. So that's what the pigment does. Oh, okay.
So the pigment, the darker skin color you are, the more protected you are from the sun. Because that pigment, the melanin, is what protects you from the sun.
But I done work with brown skin people, even very dark, like very, very dark, Cindy Poitier color, Cicely Tyson, they blue black. But they burn really easily. They got sunburned really easily. I was like always chasing them around with sunscreen because they will burn.
Sometimes if they've never been out in the sun or they don't go out in the sun a lot, sometimes they can be sensitive to the sun.
Yeah,
Maybe.
I think so. Yeah, definitely. I don't think neither one of it do. Seriously, it's always very careful.
Mm-hmm. What I like to do. A little bit everywhere.
And the stem cells are from fruit or?
These stem cells are made. Actually, I'm not exactly quite sure. They're made in a manufacturer. They're human-derived stem cells. So they're stem cells that are made in the manufacturers that are clones of regular stem cells. And then I'm swirling this to make sure we pretty much hit everything. Because sometimes with the cross hatching, sometimes you can miss a couple things there.
Oh, I
But
see, yeah.
this way we make sure we hit everything.
Then I'll have these tiny little nipples.
Mm-hmm.
Think about the doctor. What do you do?
Makes it very even.
This microneedling, I understand, is very good for growth hair, right? Growing hair too?
Yes. Uh-huh. It can stimulate the kind of hair follicles that are there to start growing. Because what this essentially does is these little needles cause micro trauma, a little bit of trauma to the skin, and that stimulates collagen growth. So if you can imagine, your body's trying to repair these tiny little wounds, I guess you could call it, these little things there. And so by causing these tiny little traumatic things these traumatic lesions to the skin, this skin tightens up exactly and produces more collagen in reaction to that.
It's amazing what the body does. It's like a cleaning machine.
Oh, it does. Your body heals everything. So this is like a controlled, you can call this a controlled trauma.
Right. And it's gotta be skill because you have to get the pressure and everything.
Mm-hmm.
It's so important in this, no?
Yes, it is.
But
If you don't apply enough
surgeon,
pressure, yeah.
with your surgeon hands, it's so accurate.
Have to be, especially in our profession. With surgeons, especially with facial surgeries, I'm saying everything's millimeters. So if you're off by a little millimeter, it's not very good. So it's important to have a good eye and always be 100% focused in what you're doing.
I can imagine. So I had a friend of mine that she did plastic surgery in her face and actually took 10 hours.
Mm-hmm.
Oh my gosh, how do you keep the attention span for 10 hours? I'm not getting exhausted.
A lot of that's with training also.
Oh, wow.
If you're trained to do those procedures, well, so before they let us finish our residency and training, you have to do a certain amount of each of these cases. And, you have to be certified, your bosses, your attendings, your chairman has to sign off on these cases. And if you, again, same thing, if you don't have the training to do it, you don't have the stamina to sit there and do these cases, then obviously issues can happen. But if you're trained to do these cases and you know the time involved in all that, then it's not a big deal. You get used to it.
Yeah, I guess so. I guess for me it was like, wow, how fight exhaustion and concentration, because anybody, mind wanders, you know what I mean?
It's all part of the training. Like in residency training, like I allude to so many times, we work 80 hours a week.
Wow.
You have to take call on top of that. So you do that for several years. You learn.
Right.
You definitely get used to the training, the exhaustion, all that kind of stuff. You learn how to overcome it. And you find ways to, you definitely have to take breaks. Make sure you get some food in the meantime. Get some nutrients and a little bathroom break, this and that. So
Even when
you
the
learn.
surgery is going on?
Mm-hmm.
Oh my goodness.
You just you sometimes you just gotta take a break.
I imagine.
Hmm.
Yeah, I was always wondering about that, and it's like complicated surgeries and oh gosh.
A lot of times, if it's super complicated and it's in the hospital, you usually sometimes have two teams. You know, one team will operate, and then one will take a break, and then the second team will come in and,
Wow.
and and take over, and then
Right.
switch and take breaks.
Wow.
A lot of the reconstructive surgery you do sometimes takes 16, 20 hours.
Ooh.
Yeah, I've been in a I think 20-hour case before.
Wow.
Yeah. So you have two teams, and everybody kind of just switches in and out.
That's unbelievable. And that person can be under for that long?
Yes, you can. You just don't wake them up. You let them send them to the ICU, and you keep them asleep until the next day.
Oh, wow. Wow.
But you can, yeah.
That's amazing. So no partying the night before.
No, yeah.
And two, the other thing is because he's so precise. I mean, just holding your arms.
Hmm. Well, the thing, it's kind of like if you enjoy what you do and you like your work, it doesn't feel like work. You know, it's like the adrenaline's going.
Yeah.
You feel good. You don't feel tired. Next thing you know, it's already 8 hours. Like, oh, it's already been 8 hours. Like, you don't even realize how long it's been.
Wow.
Like, time flies when you're doing surgery, for sure.
Unbelievable. I always wondered about that. And I remember this girl that does, is a hairdresser friend of mine. She did her surgery, took 13 hours.
Mm.
It seems like, wow. I will lose, I think I will kind of lose, well, you can lose anything because you know there's somebody in the table that
Hmm.
is opened up and it needs,
That's what keeps you going, knowing that there's actually somebody there. Like, you can't just stop. You gotta just keep going. You doing all right?
yeah.
But yeah, some of those surgeries can be tiring, but it's rewarding. I mean, if you enjoy what you're doing, then it's not
Right.
really work.
And it depends a lot on aftercare too, no? If they don't take care of the work you did
Hmm.
or immediately. So I have a friend of mine that they did her face and all that. She thought it was ridiculous to wear
The
a
bands.
support band, and he took it off the first day.
Mm. A lot of times with surgery, you can only do so much with surgery. A lot of it's how the body heals, and then the patients themselves have to be proactive about helping themselves. You know, help me,
Yeah,
help you kind of deal. Like, you
right.
need to do these things, wear these dressings, wear these wrappings to help the results look better. Um, yeah, and sometimes if you don't follow these recommended, post-op care, then you don't get the results that you want sometimes.
Yeah, that's what I saw because she was back to it pretty soon.
Hmm.
And changing the style of life, you know?
Hmm.
If you can't back, keep smoking or sleeping, stressing out, eating
It's not good for the skin.
plastic food.
Hmm. It's definitely not good for the skin. So you have nice thick skin. That's good.
Very thick, right?
Yours is, yeah, yours is nice and thick.
Yeah, I see the thin skin deteriorates really quick.
And that's good. That means you're more resistant to wrinkles and skin issues. So you can tell because I'm using the deepest settings on this pen, and you're just getting just a little bit red. Most people get a little more red than this, but
Uh-huh.
this is the deepest we can go. So
Wow.
this will help with a little bit of, you have a little bit of wrinkles, a little bit of scarring down there. This will help break all that apart. You're 68?
Yeah.
Nice. Very good for 68. Very good for 68.
Yeah, I think it's the food and I don't know.
Staying healthy.
Yeah.
The diet and
Huge in diet.
diet definitely is a huge part of all this. Raising your upper lip here.
Good way to keep a girl quiet. Now I know what guys feel like when they shave. You've been shaving hair from
Mm-hmm.